Good evening and welcome to I'm Listening, Stay Connected. We have a great show planned for you. We have pop vocalist Melanie Pfirrman and also Dr. Jen Wider joining us later in the show. It is Mental Health Awareness Month. So, as always, we're talking about how can we center our mental health. Well, we talk a lot about self-care. We all know at this point what that is. It's about staying connected. It's the quality and consistency of the relationships we're in, so make sure you are working on those. It's also about discussing our mental health, and that's what the show is about, getting comfortable asking others how their mental health is, but also getting familiar and comfortable sharing about yours, and of course also self-care, sleeping, eating nutritiously, and moving our bodies. But what signs do we want to look for that might tell us that we need extra support and care, meaning maybe we should contact a therapist? Well, the first sign is if you are engaging in what we call destructive behaviors. And coming out of this period of time, some people are starting to engage in those and learning how to sit with ourselves brings up some old feelings and emotions that maybe feel a little bit more complex or beyond what we're able to cope with. So if you have ongoing, consistent depression or anxiety, that's another sign that maybe it's time to reach out and get some therapy. Also, extreme loneliness or a lot of negative self-talk. And of course, if you see yourself engaging in any forms of abuse directed at other people, now more than ever, we can get into some therapy. I'm working with a lot of individuals and I'm telling people that even if things don't feel extreme, it's still a great time to really work on how can I take care of myself, how can I center myself, and also just do some goals around exploration. If you want to join the conversation, you can always do so by sending your questions to hashtag I'm listening or by sending them into the DMs on our Loveline IG page. We'll be answering those tonight and of course all throughout the week. So if you have any thoughts or questions, send those on to us. Now we're going to go to Melanie Pfirrman, pop vocalist. Melanie, how are you? Thanks for being a part of the show.
Hi, I'm doing great. Thank you so much for having me.
Of course. So as always, I like to start by asking, how is your mental health right now?
My mental health is doing great right now. I've kind of started to, sit in the comfort of things in my home with this whole quarantine thing going on. I've got my own rhythm going now, so I feel like it took a minute there, but I'm feeling great now.
Good. And what forms of self-care do you see yourself engaging in recently?
Oh my gosh, absolutely. I feel like just the listening to my body and understanding what it needs. I mean, I am someone who really enjoys my alone time, my quiet time. I am quarantined with my entire family. So for me, that time for myself is just taking a drive for about an hour and just listening to my music, cranking it up. That's the biggest thing I've done for my self-care right now, and it's been working wonders.
Beautiful. And before I ask you about the music, I want to just comment on something you said. No one has said that yet about listening to what their body needs. And I think that's such a powerful statement because our body will always be the first thing that tells us what we need to be focusing on.
Oh, absolutely. I feel like my journey with, my own mental health problems and with anxiety, I feel like I really didn't figure out how to fully deal with that until I started listening to what my body needed and understanding it a little bit more. So it's absolutely very important for sure.
And as far as the music, I mean, I think that's such a powerful thing. We've been talking about this on the show a lot, how musicians and artists and different guests are using music as a way to work with their mental health. What ways do you do that?
Oh, absolutely. I feel like for a lot of songwriters, that is like the best outlet, especially for me, just, with the anxiety and depression that I deal with. It's absolutely a form of therapy, getting to just like jot down all these feelings and emotions without, thinking about it, just completely losing yourself in the music. And it's been such an important tool for me, especially during this quarantine. Yeah, definitely a form of therapy for me right now.
And congratulations on the song Suda. I was listening to that all day long. It definitely was putting me in a positive space. It was helping me do my home workout. It was helping me get through some cleaning. And you said in one of the interviews that it's important for you to not shy away from weighing in on some political things, but more importantly, you said with your music and your shows, you want to just surround yourself with positivity.
Oh yeah, absolutely. I feel like all the world needs right now is just a little bit more love. So if I can just express that in any way, shape, or form, and for me, that's with music and with performing. I mean, yeah, we all need some more love.
So is that what you'll tend to do if you feel yourself kind of dropping into a lower mood? You'll play music to kind of bring you back up?
Oh, absolutely. And not just play music. I have like a little karaoke machine set in my room. I'll just crank that up and I'll sing my little heart out. And my parents love it. My neighbors love it. But I do that for myself, and it's been another great tool for me to use.
Yeah, luckily I'm self-isolating alone, but nonetheless, I would never put myself on karaoke because nobody would enjoy that.
I bet that's a lie.
I don't know. Maybe I'll send you a few quick clips. But talk to me about self isolating with family members, because for a lot of people I'm working with clinically, that's brought a lot of triggers and a lot of overwhelm. What's your experience been with them?
Yeah, well, I have a very, very close-knit family. We are each other's best friends. We always have been, even growing up. So it's actually been really wonderful getting to be with them and kind of spend more time together. And we're getting to know things about each other that we didn't really know, prior to this whole thing. But yeah, like I said before, I feel like as much as I love them, I feel like when I need my alone time, I need my quiet time. I feel like every single one of us has gone through a period where we're like, okay, I love you so much, but I need you to be quiet. I'll be quiet. We need to all just sit in silence for a little bit. And they're incredible. I love my family so much, but yeah, we need some quiet time every once in a while. So
No, I love that you're able to say that, though. As much as we might love the people that are around us, it's completely healthy to take time away and kind of set those boundaries.
oh, absolutely. I have a 12-year-old niece that all she loves to do is play Fortnite. So I'm hearing her scream with her little friends over her walkie-talkie all day, which is
Awesome.
sometimes fun, but need that quiet time.
Let's talk for a minute about resilience. You said that, you came from a family that wasn't privileged and you really understand struggle and you appreciate every win. Where does your resilience come from?
It absolutely comes from my parents, and the upbringing. Once again, they have just taught me from day one to just appreciate life, appreciate every single thing that has been given to me, and to understand that nothing is just going to be handed to me. It's going to take a lot of hard work, a lot of dedication. And my parents have been so incredibly supportive of my dream. They were also musicians, so they understand, just how important this is to me. And they've made sure from the beginning that I keep a good head on my shoulders and that I stay the course and never give up. So yeah, they have been my constant source of support for sure.
Oh, that's really, really, really beautiful. And are you also using your time to stay connected socially? That's one of the things I'm kind of preaching, and even our own governor here in California was saying that. He said, and I thought this was really beautiful, reach out to at least 3 people a day and stay connected. Are you finding the time for that and the energy?
I am, I'll have to admit that at first I was not. I was kind of very secluding myself, and I realized later that you need that social, interaction with your friends and your family, and not just the people that you're in the house with, quarantining with people outside. You have to stay connected to the outside world, to stay sane. So yeah, I've been, my best friends and I have like a little text thread going, and we make sure that we text each other every morning to make sure that we're all doing good, what our plan is for the day, even if it's just watching TV all day. So yeah, definitely important, to stay connected for sure.
That's beautiful. And I think sometimes when there's not a lot of things going on, our conversations can get even more honest and vulnerable.
Oh, absolutely. I've had so many deep late night conversations, with so many of my best friends. So that's one beautiful thing that has come out of this whole quarantine thing. So
Yeah, that's what I'm telling people I'm working with clinically. Either release some of the relationships you're in if they're not making you feel good, renew some of the ones that you've always wanted to get more connected or closer to, or start some relationships with others. I mean, I've been shocked to see some of the people that have come out of the woodwork that I haven't talked to in years, and it's been really, really beautiful because either they were lonely and they needed to connect with someone, or I've been on their mind, and it's just been really beautiful to see who's reached out.
I love that so much. And I've actually been able to interact with a lot of fans, like on a personal level, who have just felt comfortable enough to message me randomly and say, hey, I'm having a really terrible day today. I'm having trouble staying focused and staying motivated. Like, what do you do? Like, what are your, what are some things that you do to stay motivated? So it's been kind of nice to even connect with people that I've never met before just through the internet, and being able to help people in that way. So
That's beautiful. I'm glad you do that. And I guess I would love for other people in the industry to do that. I've had people reach out on my DMs and they're unsure that I'm going to respond. And it means a lot to them when they do. But I think they don't also realize that for people like yourself, it feels good for you to have someone to maybe connect to in that moment.
oh, absolutely. It's not just for them. It's for me. I mean, you have no idea what that means to know that somebody out there even feels comfortable enough to express those feelings to you, someone who is a complete stranger. So it means the world to me, truly.
And before we go to some of the questions that came in, I wanted to just reference something that keeps coming up, and it came up in an interview with you as well. You really wish you had a song in a Nicholas Sparks film, especially The Notebook. There are a lot of people talking about The Notebook right now. What's that about? What's going on?
I don't know what it is. Noah Calhoun. He just like steals the hearts of everyone. And even Allie, like their whole dynamic as a couple, their whole story from start to finish. It's just a beautiful thing. And I'm such a sucker for any kind of romance novel, so especially Nicholas Sparks. So I'm a sucker.
Well, you put it out in the universe, so the universe tends to sometimes give us what we're asking for. So fingers crossed that you get
Exactly.
something like that. So we had some questions that came in, and for those that are watching and want to join the conversation, you can do so by sending your questions at the hashtag I'm listening on Twitter or in our DMs on our Loveline IG page. So Melanie, some questions came in that I'd love for you to answer with us.
Sure.
First one. Oh, I like this one. What is your number one dream collaboration?
Oh my gosh. My number one dream collaboration is with JoJo or Tori Kelly. I can't, people have asked me to pick just one. I cannot. I simply cannot. They have just been two of my biggest role models for so long, not just vocally, but just who they are as people and how they advocate for others online and just the platforms they speak on. And just their vocal abilities also just kind of blow me away every single time I hear either of them open their mouths. So yeah, that's a huge dream of mine to collaborate with either of those. I'd be so happy.
I love that. This question asks, what advice would you give to people who have parents who don't respect how important mental health is? My parents are both from Mexico and they don't buy into mental health. They just say toughen up.
Yes, I completely understand that because believe it or not, for half my life, both my parents didn't really understand what mental health was either. There was just such a stigma on and around mental health, especially back in their day when they were children and growing up, even into adulthood. And so as I was learning about my mental health issues, I was kind of helping them understand it as well, because, you know, a lot of this stuff is generational. And, you know, if they had no idea what mental health was and how they could help me, you know, how were they going to be able to do that? So it's been kind of a journey for me, getting to explain these things to my parents and tell them, no, I'm not lazy. I promise. I'm just depressed. I'm in pain. I'm suffering. And I think having them take the time to listen was very important. And if you can just sit down with them and try to lay it out for them in a simple but, you know, demanding way that you need help, and that you need them to listen because your parents are, you know, your biggest support system. So yeah, I'm so sorry that you're dealing with that, but I hope that you guys can sit down and kind of come to an understanding. It's important.
Yeah, that was such a beautifully compassionate response because I think sometimes people do the best they can with the way that they themselves were raised and what's familiar to them. And like what you said about just lovingly trying to kind of share what your needs are.
Absolutely. It's so important, especially with mental health. I mean, the way that mental health works is it affects our entire body. I feel like you know, there are so many physical things that happen to your body when you're dealing with mental health. It's such a serious situation. So it's not something to take lightly. And, you know, if your parents obviously love you so much and they want to hear you out, and I'm hoping that you guys are able to have a good conversation about it.
Yeah, and there's something so powerful when we share and discuss our mental health around people. They get a little more comfortable, a little more familiar, and hopefully it says to them, I'm the kind of person you can come to at some point. So I love that answer. We have one final question, and this one asks, what made you decide to pursue a career in music? Were there points where you faced uncertainty, and what helped you push through it?
Yes. Okay. So again, my parents were actually both in the music industry before I was even born. My dad was a producer and also a musician. My mother was a singer, like back in the 80s with the big hair, all of that. That's when they actually fell in love. They were working on a project together. And so, yeah, it's just kind of been in my blood, honestly. I think at a very young age, I knew that there was no other path for me than music, and to pursue that. There absolutely have been moments where I felt like all I could do was give up. And I was very close to, at one point in my life, a few years back, I was in a very terrible management situation with people who didn't believe in me at all, people who wanted to completely change who I was as a person and as an artist. And I kind of was fed up for so long. And I feel like most of the magic happens right when you're about to give up. So if anyone's listening, if you're feeling like you're going to give up, do not do it because there is magic just around the corner. I promise you.
Beautiful. Melanie Pfirrman, thank you so much for being a part of the show. Congratulations on all your success, and thanks for the vulnerability.
Thank you so much for having me. I appreciate it.
Have a beautiful night.
You too. Bye.
So many beautiful messages in there. Number one, again, listening to our bodies. Our bodies will communicate a lot to us. And sometimes it's more honest than our thinking. And if you're feeling something, some tension, some anxiety, it's your body asking for a need to get addressed or met. I do that all the time myself, where someone makes a request or I'm struggling with making a decision, and I just pause and I check in with my body and I see if it makes me feel safe or uncomfortable. It's such a powerful barometer. But also just talking more about mental health. Some of us are raised in families where it's not something that our parents or the others around us are familiar or comfortable with, but we can start to normalize mental health as a discussion and something that we can talk about by bringing it in slowly and getting people familiar, hearing about it, asking about it. And so do that difficult work, especially right now. It's May. It's Mental Health Awareness Month. We have some questions. If you want to send some in, you can do it by tweeting at #I'mListening or by sending them into our DMs on Loveline. This one asks, I went through a harsh breakup and I can't stop lurking their social media. I know it's bad for me, but I can't stop. How harmful is my Insta stalking? Yup. God bless social media. It gives us immediate access to everything that's going on with those that might have let us down, disappointed us, or broken up with us. I'll say this. We are often really good at physically separating ourselves from someone during a breakup, but we keep ourselves emotionally and psychologically still very close and connected when we're looking at their social media consistently. And that doesn't let us get over the breakup. And so one of the most powerful things we can do for the emotional, psychological part of mourning the loss and moving on is not looking at their social media. So remember, it keeps you stuck and it doesn't let you heal. So do the best you can to stay off of that. And now we're going to go to Dr. Jen Wider, our medical expert. Dr. Jen, how are you?
Good, Dr. Chris. How are you?
I'm good. It's been too long. I feel like I haven't seen you in a while.
I know. I'm still in the same spot. Here I
am. God bless it. Me too. So I have a couple honest questions and things I wanted to discuss because I have some concerns. So we're watching the news and I'm seeing those photos. God bless United flight. People packed in there. And what was concerning is when we look at what they say are the things we need to avoid, enclosed spaces for prolonged periods of time. How safe or unsafe is this? Because I knew the airline had said that they were going to leave middle seats empty. We see them packed in. Unpack this for us.
Okay, so I also saw those pictures, Chris, and really sort of shuddered when I saw them because, here's an industry that's basically bleeding at the seams. I mean, they've had, a 90% decrease in traffic. This is an industry that was hard hit. And one of the things that's most concerning about me are that from pictures that are coming out of United Airlines is there's sort of this promise from the airlines that the middle seat was going to be vacant, that there would be social distancing practice on board airlines. There were a whole bunch of first responders on that United flight coming back to the West Coast. They had volunteered, doctors, nurses, technicians had volunteered to help in New York City. They were flown over in a very good PR stunt by United, and on their way back, they were stuffed like sardines into a packed airplane with people that presumably are exposed to COVID-19. So, yeah, I think we really need to think long and hard about the guidelines when we go back to flying. I think that was one of the worst things that could have happened to United Airlines. And of course, we realize that a lot of these travel industries, they're profit driven, of course, and we can't blame them. They're a profit driven industry. But unfortunately, it's not going to help business much with pictures like that are really fear-mongering for the general public that is timid at best to get back on a flight. In fact, Chris, I looked up a statistic recently. They polled Americans about when they felt more comfortable going to fly during this pandemic, and it was 40 to 60% of Americans. It was a UCLA study that said that they're very timid about going back on an airplane. Even when public health officials lift these restrictions, people are going to drag their feet to get back in the air. And I think pictures like what we saw yesterday from United is not helpful.
Yeah, it makes me feel unsafe. I mean, I always already questioned a lot of the forced closeness that comes with travel. And seeing those photos, it doesn't make me necessarily feel as though travel is going to feel safe anytime soon. So I'm watching to see what happens next because I don't know when I would feel comfortable getting back on that bad boy.
No, and I hear you. I'm a germaphobe to begin with. So before the pandemic, I'm always seated behind somebody that has a cough. And I'm always sick after every flight that I take because, there's recycled air. And although I've done a lot of interviews with people, in the flight industry that will tell you the filtration system on airlines is pretty good. The chances of getting sick are low, but the air is still it's dry. You feel sick. People are closed in there, and I'm with you. This is not one of those activities that I'm going to jump back on board. I'm going to take a wait and see approach as well. But I do think one of the scarier things is that there need to be some sort of federal guidelines coming down, Chris. These haphazard guidelines that different airlines are going to institute is what scares me the most. It's very anxiety provoking. I really do believe that in order to get these industries up and running again, whether they're entertainment, whether it's our travel industry, on planes, trains, automobiles, all of these things, there need to be some universal guidelines so that we do have a sense of safety and security. And that's what I see lacking. United made this promise, and there were a lot of people on that flight, and you can see them quoted in the news that they were just absolutely shocked that the middle seat was taken. Every single seat on that flight was taken, and it was startling to them. And when you get on an airline and you click your seatbelt, you're stuck. The laws and regulations of your particular state go out the window, Chris, because you're stuck on an airline. And you're on this sort of international travel law. And unfortunately, people wanted to get up, and once they close that door, you're in trouble. So I think the airlines need to be very thoughtful about putting in best practices for both the flight attendants, really, Chris, and also the passengers. I mean, the flight attendants are at risk as well.
Yeah, that's what I worry about.
If you look at some of the studies in South Korea, a lot of those flight attendants they're wearing gloves. They have N95 masks. These are the practices that we really need to pay attention to, because the airline needs to worry less about profit right now and a little bit more about their employee safety and security and their passenger safety and security, because ultimately that's what's going to drive the profit in the end.
Well, this conversation has my anxiety spiked. So thank you. And let's keep spiking anxiety with my next question. So over the weekend, I saw a lot of photos, specifically this one restaurant in Colorado who was overflowing with diners for Mother's Day, went against the governor's orders. So I wanted to ask you, as a doctor, a medical professional, but also a parent, what should we be looking for to feel safe going back out into the world? Because from a mental health perspective, I'm definitely empathizing with the need for us to get back out and to socialize, to get routine back in our lives. I'm working with people where the depression is spiking, the anxiety is spiking, but I also want to be thoughtful and cautious about the safety of that. So as both an 100%. MD and a parent, what do you need to see happen for you to feel safe going back out, or even letting your children go back out as a parent?
Right. This is like the $1 million question. I think your points are incredibly important and they're poignant. I think this is, again, echoes what I'm saying about federal guidelines. We should see state by state by state having the same precautions in restaurants, in, gyms and salons, in barbershops. These are the kinds of things that we need some real leadership from above, whether it's the CDC, whether it's infectious disease departments at major national institutions. This is the kind of thing that we really need as consumers. On my side of the country, Chris, on the East Coast, we have New York, New Jersey, and Connecticut talking together, the governors talking together about a 4-point plan to put business back, to issue businesses and how to move forward very slowly and methodically. As far as restaurants go, I really think it's very, very important not to sit shoulder to shoulder in a restaurant. I think as the weather gets warm, as we're moving into the summer months in this country, it's really important to look at outdoor eating and to space those people appropriately. The tables need to be spaced. For my comfort level as a mom, if my kids were to go out to eat with friends, I would want those tables spaced. I would caution them to only eat outside at this point. You want to make sure the workers, the people preparing your food, have the same guidelines that, again, should be issued from above. I think universal guidelines that if somebody is showing symptoms, if they feel sick, if they're coughing, they need to wear a mask, they need to wear gloves. If you look at the Starbucks drive-thru in my town, it's still open, this drive-thru window, but none of the workers are wearing gloves. And that's a little startling to me. Someone could sneeze or cough directly into the cup. There need to be guidelines, at least coming from Starbucks, headquarters saying, listen, you're preparing food, you should wear a mask and gloves. I think the same thing needs to be true in our restaurants. And I really believe the social distancing should apply to the tables, Chris, and also to outdoor dining. I would utilize that as much as possible in these warmer months.
Yeah, I'm thankful that the warmer months are coming so that we can try to sit and eat outside, because otherwise
Yeah,
I'm eating at home. All right, we
me
have some questions
too.
that came in that I'd love to have you answer for us.
Sure.
This first one asks, if I take an antibody test and it comes up positive, how would I know if I'm currently carrying or have the virus? Is there anything those who test positive should know or be careful of?
Well, here's the issue with the antibody test. So unfortunately, the FDA loosened up guidelines to release these antibody tests for a lot of different private companies. So we saw a lot of different private companies rush to produce antibody tests that unfortunately have not been vetted yet by the FDA. Now, there are a few companies that are slowly getting vetted. What that means, Chris, is that some of these antibody tests that we can now take, and they're serological tests, Chris, which just means that you prick your finger and you get a little bit of blood, and then you get the results of the antibody test. So unfortunately, there's a large degree of false negatives and false positives on this antibody test. So it's hard to really trust the results completely. However, as we hone them and they become FDA vetted, there are different types of antibodies that we can see, and either the blood lab should explain this to you or your doctor. If there's an IgM antibody, that means there's an active infection. And if there's an IgG antibody, that means that there was an infection that your body has produced antibodies to. The issue really comes down to, Chris, how long do we have immunity for COVID-19? And that's why these antibody tests are a little bit more important right now from an epidemiologic standpoint rather than an individual standpoint. So if I get an antibody test and I'm positive for IgG, I've been exposed to the disease, and my hope is that I have long-term immunity to this. Unfortunately, the medical research community does not have an answer to that yet. We're not sure what the immunity that's conferred by having antibodies is, and more of that is needed to be determined with future testing. So hopefully those answers are going to be short in coming, but these are the types of things that we need to understand before we flip the switch and go back to normal society. How many people were exposed, what our herd immunity is, and is it enough that we are now immune as a population to go back to normal living?
And that's
that we don't have the answer to.
And that's what's so powerful for me is you're saying, like, wait, we have to wait and see. It's a novel virus. These things aren't definitive. And so we're opening up the doors way too soon, trying to go back to normal. Yes?
100%. And I empathize with everybody feeling anxiety, depression, people that are feeling what I call and other people have called quarantine fatigue. I mean, we're all seeing that. I live with a first line responder in my home. My husband is actively in the hospital treating patients. So my information is grounded in the fact that he's still seeing disease in the hospital and people are really sick. But for the average person that doesn't have access to that on a daily basis, it becomes really confusing. We've been harboring at home for 8 weeks, 6 to 8 weeks in a lot of places. And people, quite frankly, they're tired of it. They're stressed, they're depressed. They want to get back to their routine, which I completely understand and can sympathize with. The problem is, and the question really is, are we going to open the doors a little bit too soon and then see a spike of disease? Or will this naturally slow down in the warmer months and then we'll regroup in the fall and hopefully have some viable treatments that's going to make this a little bit easier to deal with as we move forward to finding a vaccine?
Oh, man. So much to be revealed. It's a lot of wait
I know.
and see. Dr. Jen Wider, thank you so much.
Thank you so much, Dr.
Have
Chris.
a great night.
You too.
All right, y'all, we still got to be safe. We got to take precautions. Look, again, mental health, it's important as physical health. So I advocate for us to continue to focus on self-care. It's not necessarily time to go back out, but there's a lot of things we can do, as we talk about on the show, to make things as mentally healthy as possible. I have another question that came in. This one asks, I said something really hurtful to a friend on FaceTime the other day, and she won't talk to me. How do I make it better and let her know I'm truly sorry? Listen, care and compassion. We're going through a rough time. A lot of things are amplified. People are overwhelmed. So yes, on one hand, I'm saying, please let things go. But more importantly, when someone apologizes and takes accountability, we have to bring them back in. We can't cut off friends, loved ones, and family members every time they let us down. Now, again, if they're consistently letting us down, that's a different story. But if someone comes back and they apologize and they're accountable, we want to bring them back in. And so that's my answer to you. Let them know you're sorry. Talk to them and share with them that you understand why and how you hurt them and let them down. And just tell them that you're going to be working on making sure that it's better and things are different next time. And that's how we feel safe bringing someone back in. So as always, focus on self-care. Be loving with those around you and with yourself. It's really tough times for all of us. And for some of us, we are around triggers with family members, trying to work from home, doing the best we can. So self-care, self-care, self-care. But importantly, mental health. Ask those around you how they're doing. Talk to those around you about how you are doing. That is how we're going to come out of this as mentally well as possible and try to decrease the collective trauma that we might have coming. On our next show, we have Dr. Jenny De La Cruz, family therapist and grief and trauma specialist. If you have any questions, you can do so by sending them to #I'mListening or in our Loveline IG DMs. We'll be back tomorrow night at 5 p.m. Pacific. That's 8 p.m. Eastern on all the radio.com handles. As always, thanks for hanging out, and y'all have an awesome, awesome night.